Hey, I'm Dr. Gay with Fairview Medical Group Orthopaedics, and we're here this morning to talk a little bit about knee arthritis and its definitive treatment with total knee arthroplasty. So we're just going to go through what we usually talk about with a patient when they come in the office and they have knee arthritis. So if you can see these x-rays, we'll talk a little bit about arthritis, but I'll just point out that you can see how there's no space left between the bones on the inside of this patient's knee. So this is the patient's femur bone or their thigh bone, and this is the patient's lower leg bone or what we call their tibia. And you can see the space between the bones on the inside is gone, where on the outside you can see there's a black space between the bones. That space really represents cartilage in the knee. All arthritis is when the cartilage in the knee completely wears out. So I tell people, my patients, that it's like wearing the tread out on the tires of your car, that you've just worn out the padding and the cushion in between the bones. So when you walk, the bones start rubbing together and creates pain and discomfort. Now, one of the things that patients ask about is, well, what about bone spurs? What are bone spurs? Well, we call them osteophytes, and all bone spurs are, which you can see on this patient's knee here, are just bony overgrowth from the cartilage wearing out in our knee. For whatever reason, when our joints wear out and the cartilage is gone, our body responds by forming bone spurs or extra bony formations around the patient's knee. So typically we'll treat arthritis initially with things like oral anti-inflammatories, which are medicines like Motrin, Aleve, Advil, and then prescription forms of those medicines, things like Celebrex or Mobic. That typically works well for people initially, and then when that stops working, you can move on to things like injections. Cortisone injections being the most common, and then when cortisone injections stop working, occasionally we'll use the so-called lubricating injections, or rooster comb shots as some people call them, to help treat the symptoms of arthritis. But no matter what we do, nothing makes the cartilage or that space in between the bones regrow in people's knees. We just treat the symptoms, and then when the patient can't tolerate their symptoms anymore, then we move on to talking about surgical treatment. The only definitive treatment for somebody once they develop this type of arthritis in their knee is a total knee arthroplasty. The most common question I think I get asked is, what is a knee replacement? So I'm going to show you a model here about a knee replacement and what it is. So if you look at this, this is a model just like of the x-ray of the patient, where this is their femur bone and this is their lower leg bone. So that patient's cartilage space, which has worn out and the bones are now rubbing together, to fix that, what we do is I go in and open the knee up, and then I shave the ends of the bone off with a saw to get rid of the worn out cartilage. So the femur or the upper leg bone gets shaved off in this sort of stop sign like shape. The lower leg bone gets shaved flat or straight across the top. We're then able to take a metal cap, which we glue or cement in place on the end of the upper leg bone or the femur. We then take a metal tray and we glue it or cement it into the lower leg bone, and then you lock a piece of polyethylene or plastic-like material into the tray and then put the knee back together. That then becomes a knee replacement that moves, and the plastic or polyethylene acts like cartilage. The kneecap also sits up in front of the knee here. We've kind of flipped the kneecap over and put a plastic button on the back of it. We did not take the kneecap out, which is a common misconception, and you don't cut the patient's bone off up high and down real low and replace it with a big heavy metal thing that goes in between, which a lot of people think. It's really more of caps that get put on the bone and then a piece of plastic that goes in between that takes away the pain of the bones grinding together. And that becomes a knee replacement. The surgery itself generally takes about an hour to an hour and a half to do. Patients usually spend about 2 nights in the hospital if things go well, doing inpatient physical therapy. And then probably 95% of patients we transition to home at that point with home physical therapy for 4 weeks, and then transition them to outpatient physical therapy from there. It takes about 6 weeks probably to be about 85% recovered, and by 3 months I'll let people go back to things like golf or tennis or sporting type activities. So that's what knee arthritis is and how we fix it with a knee replacement.